Hi, my name is Madeline Welsh, and today I interviewed my mother, who is a nursing director at Methodist Specialty and Transplant here in San Antonio, Texas, and one of my best friends, Elizabeth, who is a child care after school worker. So I asked them, how has coronavirus impacted you or your family and friends' employment situation? So both of these individuals talk about their employment situation and how it's changed because of COVID-19 and quarantining.
Good morning. My name is Brenda Lacewell. I'm the nurse director at on the transplant care unit at Methodist Specialty and Transplant Hospital. I want to talk to you a little bit about how COVID is affecting our everyday life here in the hospital. We are seeing a lower census in our hospital, so staff is rotating, taking on call or being canceled for their shifts. Our hospital system has been very generous in allowing some additional monies to be utilized for staff during this time to prevent them from getting into financial difficulties. We are not allowing anybody to work any overtime. We are only using full-time and part-time staff. We are not using any PRN or as needed Methodist staff. We're also not using any agency nurses. All elective cases have been canceled, so our hospital census for overall is down, but we are using people from areas where there aren't patients to clean in the hospital, to do other things, to screen people at the front when they come in, to do temperature checks. We are doing temperature checks and screening for anyone entering the hospital. We are not allowing currently any visitors to come in, so it's just people that work here and or vendors coming into the facility. Everybody does wear a mask 100% of the time they're in the building. I have mine off right now because I'm in my office, but anywhere where you're out, that you would be walking near someone, we're asking folks to follow CDC guidelines and wearing masks. We did have about 1,500 masks, fabric masks donated from various people. So we're very fortunate for that. The PPE or the hospital masks, our hospital system has been very diligent and proactive in making sure we have enough. So we do have enough PPE for our patients and our staff.
Hi, my name is Elizabeth Greer. I work at Castle Hills Elementary as a KIN assistant, which stands for Kids Involvement Network. I work with kinder and first graders normally every day after school. It's an after-school care program for kids that can't ride the bus home or their parents can't pick them up after school, so they stay after school, and we do scheduled activities with them and have homework time, and I love my job. With COVID-19 and the school closures, I'm currently out of work, but fortunately NEISD passed a resolution to still pay their employees, so I'm still being paid about half of what I would normally be paid, which is kind of unfortunate, but the fact that I'm being paid at all is a blessing. So it has definitely been an adjustment being out of work. I really miss my kids. I miss the joy that they brought me. I'm studying to be a teacher, so I miss having that one-on-one interaction, just to feel like I'm building up my training for when I do become a teacher, and working with these kids just really helps me to grow as a future educator and just know more about impacting their lives and being there for them. So it's definitely been difficult. Being out of work just kind of makes me feel all out of whack and my routine's super off, so it's definitely been a big adjustment,